July 2011. The situation in Somalia, despite being chronically precarious, hit an all-time low. Severe food scarcity, caused by 2 consecutive failed rain seasons, resulted in alarming malnutrition rates and massive deaths due to hunger and hunger-related illnesses. The already critical situation was exacerbated by the insecurity and resultant limited humanitarian access in many parts of southern Somalia, a result of over 20 years of protracted conflict. An estimated 4 million people were reported to be in crisis, with 750,000 people at risk of death in the following months. Children with already weakened immune systems due to the chronic food insecurity died in large numbers. These devastating conditions led to the declaration of famine in 5 regions of Somalia, among them Bakul and Mogadishu, where ACF was carrying out its life-saving interventions. For Mogadishu residents and internally displaced persons, the situation was particularly dire. Years of conflict has resulted in congestion of people in IDP camps, where the infrastructure, basic facilities, and humanitarian assistance is limited. With the famine came even more displacements. In response to the emerging humanitarian needs, ACF significantly upscaled its operations in Mogadishu, Benadir region, and Wajid in Bakul region. Through integrated programming, ACF provided treatment to severely malnourished children under 10 years through its 13 outpatient therapeutic centers and 3 stabilization centers. ACF conducts malnutrition screenings of children at its MCH and nutrition centers as well as through community outreach. ACF is currently engaging community nutrition workers to ensure early detection and treatment of nutrition. Ready-to-use therapeutic food was provided to children referred to as ACF's outpatient nutrition programs. Caretakers were educated on proper use of the therapeutic food to ensure proper recovery of the malnourished child. The children stayed in the nutrition program for an average period of 40 days. Due to household food scarcity, ACF also distributed protection rations for households with children admitted at the nutrition centers in order to reduce sharing of the therapeutic food amongst household members, which in turn resulted in increased lengths of stay in the nutrition program and slower recovery of the malnourished children. In the stabilization centers, malnourished children with medical complications and who were too weak to eat were admitted as inpatients and fed intravenously. ACF provides lunch to the caretakers and other children accompanying the malnourished child to the stabilization centers. Over 80% of the malnourished children admitted in ACF's nutrition program are cured, and the improvement in the children's health and overall status is remarkable.
As ACF, we decided to start treating pregnant and lactating women to be able to address the causes of malnutrition. It came out after some research, it came out clearly that poor child care practices were contributing to malnutrition. So, again, looking at the element of building in resilience, we decided to catch the pregnant and lactating women. The pregnant women, so that we are able to address the window of opportunity. When the child is conceived, we want to teach this woman on how to take care of herself during her pregnancy so that she's able to deliver a child who is healthy. So it's very important that they eat healthy, they know how to use the locally available foods, and how to seek early treatment when they are sick, so that at the end we have a child who is well nourished. At the same time, we are able to train them on how to take care of the rest of the children they have at home, on good diet, actually using the locally available foods, just to come up with something that is good. And then ACF provides for what is not available by providing the ready-to-use therapeutic food.
ACF screens pregnant and lactating women at its mother and child clinic in Mogadishu in order to treat malnourished mothers and prevent the resultant malnutrition of their infant children. Women in the third trimester with a mid-upper arm circumference of less than 21 centimeters and lactating women in their first month of breastfeeding receive PB5, a high-energy biscuit providing 1,300 kilocalories to their daily diets. ACF ensures that all women receive antenatal care to ensure the health of mother and child. Medical checks are conducted to all women visiting the MCH clinic. The women receive immunization against tetanus, micronutrients, and anti-malarials to prevent anemia and malaria. Expectant mothers and caretakers of malnourished children receive counseling on safe delivery, exclusive breastfeeding, and infant-young child feeding practices. At ACF's outpatient medical department and mobile medical clinics, children aged 0 to 10 years were treated for various illnesses including upper respiratory tract infections, malaria, intestinal worms, diarrheal diseases, and skin infections. Children were also vaccinated against various immunizable diseases.
What one is trying to do is trying to look at both the treatment aspects of undernutrition and the preventive aspects of undernutrition. One is trying to see that there is adequate link between both the treatment and the prevention aspects of undernutrition. For preventive aspects, there's a lot of interventions that ACF have been carrying out in Somalia, especially in South Central Somalia, focusing on the whole aspect of food security and livelihoods, complemented by water, sanitation, and hygiene interventions. This ensures that children who are under 5 do not get undernourished because of inaccess to potable water, because of inaccess to proper hygiene and sanitation.
ACF undertook regular chlorination of shallow wells to ensure consumption of safe water by the community in order to prevent water-related diseases. Some of the shallow wells were also rehabilitated to ensure provision of high yield of water, as well as protection from contamination. Hygiene kits containing water storage containers, soaps, household water treatment tablets, and sanitary cloth were also distributed to vulnerable IDPs. To increase latrine coverage and prevent open defecation, which can result in the spread of diarrheal diseases, ACF constructed latrines with hand-washing facilities for use by IDPs and residents. The latrines were constructed in collaboration with the targeted communities and gender considerations made to ensure safe and equal utilization by both genders. Hygiene promotion sessions are carried out at ACF's nutrition and health centers, as well as through house-to-house visits in order to emphasize on importance of good hygiene practices. General food distribution in Wajid and distribution of unconditional cash grants in Mogadishu were also undertaken to increase household food access. The targeted households by ACF either had children admitted in ACF's nutrition program or were identified through community-based targeting. Through the unconditional cash grants, vulnerable households like Hindia were not only able to buy food items, but also had the choice to use their money to meet other essential needs, like medicine, clothing, and school fees based on their priority needs. The cash grants also enable the beneficiaries to pay their debts or have access to more credit or invest some of the cash in small-scale businesses.
وأقبضنا هدي نبلا إلا كأنت ليسي.
ما شاء الله. هي العقد من كل عقد ولا بس يسمع. حتى كنت سنة كنت أول كنت قدرت.
قدرت. وقالوا كده أنت راك السنة المهية وناسيس.
The majority of the targeted beneficiaries were IDPs whose livelihoods had been crippled after they had to flee from their homes.
حاجات تصبح حاجات تصبرك عليه شينها قبلكي شبه لها دخل أي مكان نقول إسا هذا دروكتو
Over the years of conflict and repeated droughts, there has been a depletion of coping capacities, of the depletion in the resilience mechanisms, the traditional resilience mechanisms. And that is why it does become very important and pertinent for us to strengthen those resilience mechanisms within the communities, to help the communities recover the traditional coping mechanisms.
While the government of Somalia remains responsible for rebuilding of the war-torn country and ensure provision of basic needs to its citizens, continued international support is vital. Much still remains to be done, and ACF will continue to provide assistance to the people of Somalia through treatment and prevention of malnutrition, as well as enhancing the capacity of communities to rebuild their livelihoods in order to promote their dignity and make them more resilient to future shocks. ACF will also proactively engage the humanitarian community to ensure that the needs of the Somali people continue to be prioritized.